Texas is seeing a surge of whooping cough cases, almost doubled from last year. Texas health officials are reporting 3,500 confirmed cases this year, the highest in 11 years. Health officials say the uptick in the highly contagious illness coincides with the decline of vaccination rates. But doctors say the bigger concern is how many more cases they're seeing year after year. So we're going to dive in deeper. Joining us now to talk more is pediatrician and a member of the Texas Medical Association Council on Science on Public Health, Dr. Hector Ocaranza. I'm sorry, I butchered your name. I think people mess up mine all the time, Koyman. That doesn't make it all right, but welcome to the show. Thanks for being here.
Thank you very much for having me.
Thank you. So I'm reading here, you're on the State Board of Public Health, and this is the second year in a row that the state of Texas has had to issue this health alert for whooping cough. So what is this data telling you about what's causing the crisis?
This is a concerning data trend because we're seeing an increase in whooping cough cases, and in particular in the pediatric population. And this is, as you mentioned, related to the decline in vaccination rates. We're seeing more and more children getting affected, and we as pediatricians, physicians, and public health professionals are still recommended very strongly that all new parents receive the Tdap vaccine, which is the tetanus, diphtheria, and cellular pertussis vaccine, because a lot of these young parents as adults, they feel that they don't need vaccinations, but unfortunately for them, and this is something that we continue to strongly recommend for them, that they still need to get shots, they still need to just keep their vaccination records handy because they need to continue receiving vaccines.
Right. I mean, if you've ever had whooping cough or if you know anybody who has, I mean, it sounds just horrendous. What are the symptoms and how scary can this be for families?
Definitely. The whooping cough is, as it mentions, it's just a cough that progressively gets worse. And it is very frightening, especially for infants, because they start having that characteristic whooping, which happens after the age of 6 months. But the most frightening part of the whooping cough is in younger infants, where all of a sudden they can stop breathing, they can turn purple, and that is a very true medical emergency. These children may even they can die.
Yeah, I know. And that's why at the first sight of, a child dealing with this, you really ought to seek medical attention because it can go south really quickly. Who else is vulnerable for whooping cough?
I beg your pardon?
Who else is really vulnerable? Like the elderly? Would they be?
Yes. The people that are very vulnerable are the elderly as well, and those that are immunocompromised. And people that are immunocompromised can be those people that take steroids for a long time, that take biologicals, or they're receiving chemotherapy treatment for cancer. So those people are still particularly very, very vulnerable to the whooping cough.
All right, well, I want to switch gears too, because what we're seeing this trend in, the state we're seeing it in is Texas, and they just went through a measles outbreak too that's been all over the news. So now your state is seeing an 11-year high in whooping cough numbers. What is the state doing to get a handle on both of these issues?
Well, this is a good example as why we need to continue strongly recommend vaccination and not put in doubt the safety and efficacy of the vaccines. Vaccines are here to protect us and to save lives. And this is a great example. Another example would be the measles outbreak that we had here in Texas, that it was one of the largest in the country as well.
Yeah, and as we got to wrap up, but as we head into cold and flu season, or as it's really starting to be upon us, some of those first signs that we can look out for, right? The nostrils flaring as well for breathing concerns if they're turning blue or a funny color, the sinking in at their ribs. What else before we go?
Yes, for parents, a cough that is not going to get better after 3 to 5 days, it is time to go see your physician, because initially it might be confused with a regular cold, and this is the time where we're seeing the colds, flu, RSV, and other viruses. But a cough that it continues getting worse, then go see your physician. They're the best trained to determine and send testing to see whether this is whooping cough or not. And also for adults, a cough that doesn't get better, don't wait.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.